if we address trauma, we can actually increase the incomes for the families that we work with. In other words, we can increase their ability to find a job and to keep a job. That looks very effective from the state's perspective because they need people to get into employment, right? To get off of welfare. That's sort of the goal, to get people off of welfare. So I think one of the best ways to talk with policymakers is actually to show them the evidence, not in theory, but in practice. And that's why I'm working on inserting trauma-informed approaches into the practice of what we do every day. And I'm measuring it, and I'm able to show the outcomes. This improves employment, it improves income, and probably because depression is on the causal pathway. In my world, one of the most important policy asks, and also one of the most important policy interventions, is this concept of the two-generation approach. Really, previous to the past 5 years, most people would think about, oh, let's just focus on the kids. Let's help the kids who are living in poverty, and let's get them into daycare, and let's give them behavioral health supports, which is positive, but it's leaving out one of the most important pieces of the equation, which is the caregiver. And that's, so right now, the Agency for Children and Families, which runs the cash welfare programs, the foster system, fatherhood programs, they're recognizing that you cannot take one generation and just affect one generation. Because we're so interconnected, because trauma is so reliant on the connection, especially of caregiver and child, you've got to work with both as if they're a part of a single system.
So when I think of next steps here in Philadelphia, we've been very fortunate to have a progressive behavioral health commissioner in Dr. Arthur Evans, and we have other experts across the city, Dr. John Rich, Sandy Bloom, both here at the Drexel School of Public Health. But I think we need to continue to broaden the scope of folks. We need to have this be a citywide initiative, and that's why we're very excited that the foundation has been working with the Kinney administration on this whole notion of, can we be a trauma-informed city? Can we take the policy out of a department and move it across departments and then across all communities?
In our department and in our system, we've been very intentional about incorporating the voices of people with lived experience in everything we do. And I think in the issue of trauma, it's very important because often in our field, unfortunately, because people who are trained as mental health practitioners don't get the training in trauma. That's something that typically happens once you have done your training, you come into the field and you figure out, okay, this is a really important issue. Because of that, it's really important for practitioners to hear how addressing people's trauma is really important in terms of their service delivery. So having people with lived experience, having people to hear that, but also having people with lived experience work within programs is also important. So we've really tried to do both, which is to have people with lived experience be a part of the trainings and the education of our practitioners, but also to have people with lived experience embedded within the service delivery process so that they can bring that sensitivity, that experience, that knowledge base to how we help people and how we help people to recover and get better. In addition to having organizations that are service delivery organizations, we also have funders and other foundations that are stepping to the plate to help make all of this work happen in Philadelphia. Scattergood Foundation is a great example of that, helping to support our work around mental health screenings and helping to promote that work. Also our work around mental health first aid. Those are public health strategies that are often difficult for government to fund because so much of our funding is tied to treatment. And so when we've had to push the envelope, one of the ways that we've been able to do that is to partner with foundations that see the benefit of taking these broad-based public health approaches.
The necessary next steps in Philadelphia, I think, is to dive deeper. I think that what we worry about a little bit is that the word trauma-informed is overused. And if a person has gone to one training session, or one seminar that they therefore are trauma-informed, and it's considerably more complex than that. So I think that we need to do a deeper dive within our own organizations and systemically. I think we're in that process. I think that we've been doing this for 10 or 15 years, and I think that we're getting closer to understanding it. I think we're understanding also how hard it is for service providers or law enforcement personnel to really deal with the kind of vile behavior that they've seen human beings do to other human beings. It's really hard.
I just think we have to decide as a society, as a community, as a Philadelphia, that we've hit the bottom here and we're going to ask the hardest questions up front, and we're not going to leave that table until the most inclusive, radical answers are thought of, and we put energy behind moving them forward. And we just say that we're not going to accept, I don't know, or that's not possible right now. And if that means we have to keep figuring out how to pay for it, then we do it. And that might mean new ways have to emerge. And I'm not saying I know them. I think you'd get a lot of people at a table who would be willing to figure this out, and I think you go for it. And it just can't be the city folks, and it just can't be the private sector, and it just can't be the community. That some way, somehow, and again, I'm not saying I know how to do this, but some way, somehow, we've got to figure out how to get all those groups involved and thinking and working and moving together and purposefully looking at what are the ways that we've never tried that theoretically could work, that could move forward, and new ways that we've never fully imagined possible. And truthfully, I think that people have imagined certain things they're afraid to talk about. I feel like people have imagined ways forward, including our politicians, that they're afraid might cost them their seat, right? And I honor that, right? It's this fear is real, right? Or not knowing if you'd have the popular support of an idea is real. And I respect that, right? And I don't know that job of being a politician, and it's hard, I am sure. So this isn't an indictment, but I think it's a space of collaborative ground zero, where we say enough is enough, and we're going to figure this out. If it takes us 3 years to figure it out and emerge a plan, we're going to do that, but we just do it.
To begin to really make a broad transition in all of Philadelphia, the people that are embedded in this work really, or being trained in this work, really have to believe in it. Change doesn't really necessarily happen in a really neat, linear fashion. So somebody really has to understand that and believe that what they are doing, they can persevere with it, and it will change the culture. Like we work with our individuals, we have to give a little wiggle room there as it's being practiced, as it's being rolled out, for people to make mistakes and then learn from those mistakes and pick themselves up. Again, I think it's important in the city of Philadelphia that it has to be top down and bottom up, that everyone has to be speaking the language and informed, because you can't have the people that are doing the work, doing that hard work, and the people at the top that are the policymakers and the shapers not understand what they're doing, and then sort of counterintuitively do things that undermine, not intentionally necessarily, but undermine what the work is. I'd say that unless we're all safe, none of us are safe.